Good morning, everyone. I am Anusree Saxena, Hitkani Dental College and Hospital, Jabalpur, Madhya Pradesh. I am here to represent on the topic oral manifestations of COVID 19. COVID 19 disease has been a global pandemic. Most people infected with the virus have experienced mild to moderate to severe respiratory illness and have recovered without requiring special treatment. However, patients with other serious illnesses and comorbidities have required serious treatments. Let's understand what are oral manifestations. These are the symptoms or conditions in the mouth that can occur as a result of disease affecting other organs in the body. Why these were seen in COVID 19? The reason was lack of oral hygiene, opportunistic infections, stress, immunosuppressions, hyperinflammatory response secondary to COVID 19 were the most important predisposing factors for the onset of oral lesions in COVID 19 patients. Some recognized oral manifestations of the COVID 19. Dysgeusia or altered taste was the first recognized symptom. Others included ulcers, fissured or depapulated tongue, macule, papule, plaque, pigmentation, halitosis, erythema, and spontaneous bleeding. Most common sites involved were tongue 38%, labial mucosa 26%, palate 22%. The lesions were nearly equal in both genders. As mentioned, patients with older age had higher severity of COVID 19 disease. Comorbidities are strongly associated with a poor prognosis in patients. Here is the image showing the oral symptoms that were seen, which include loss of taste and smell, dry mouth, excessive saliva, rashes in the mouth, oral ulcers, angular cheilitis. Oral ulcers. An oral ulcer is a break in the skin or mucous membrane with loss of surface tissue and disintegration and necrosis of epithelium. You can appreciate it in the image. Plaque. It is a sticky film of bacteria that constantly forms on teeth. On calcification, it leads to calculus formation. It can also lead to gingivitis, which is the gum disease. Dry mouth or xerostomia. Here is a study showing that in apparently 60% of the cases it showed prodromal symptom in 3-4 days and was gone in 1 to 2 days. It can be used as an early diagnosis, treatment, and quarantine symptom for COVID 19 and also can prevent the disease. Oral rashes, clinically known as an anthem. It is a rash, small spots on the mucous membrane. There are various studies that shows association of oral rashes with COVID 19 patients. Here is an images which shows clinical view of an anthem. It's the parietal site. You can appreciate it in the image. Loss of taste and smell. It is one of the most important symptom. A study says that the COVID binds to a protein called ACE2 that is mostly found in the nose and mouth cells. So it is most commonly associated with loss of taste and smell. Two charts showing the COVID 19 patients with associated symptoms. 62% experienced hypnosmia and dysgeusia, while more of them experienced taste loss and smell loss, followed by the other symptoms. Suggestive lesions were aphthous stomatitis, hepatiform lesion, candidiasis, vasculitis, Wasculi-like EM-like mucositis, necrotizing periodontal disease, angina bullosa-like, angular cheilitis, atypical sweet syndrome, Melkerson-Rosenthal syndrome. Angular cheilitis. It was mostly and frequently observed in pediatric patients, and it needs to pay more attention to these alarming manifestations as they may help in early diagnosis of patients. It can be caused indirectly also. A cross sectional study showed that frontline health workers revealed that due to excessive use of PPE kits, angular cheilitis was shown. Aphthous stomatitis. Here is a study showing association of aphthous stomatitis in COVID-19 patients. A patient was recovered with COVID but still developed aphthous ulcers. You can appreciate it in the image shown here. Candidiasis. It is a fungal infection caused by Candida albicans. Early diagnosis and monitoring for Candida infections and antifungal resistant infection are the key to reduce death from COVID 19. Conclusion. Xerostomia and dysgeusia are the first symptoms of SARS-CoV-19 and it should be dealt with high degree of suspicion until proved otherwise. Other oral manifestations should be dealt with accordingly in combination with treatment of COVID-19. I would like to acknowledge the contribution of my college faculty and colleagues of Hitkani Dental College and Hospital, Jabalpur, Madhya Pradesh. These were the references. Thank you for your patient listening. Thank you.